Like many campuses, CSU Channel Islands nursing program faculty have been challenged with re-envisioning traditional teaching and learning approaches for students in a virtual format, including aspects of clinical applications. Doctors Jamie Hannons and Colleen Nevins, associate professors of nursing, have been launching students into 360-degree immersive virtual scenarios using VR headsets and embodied labs since spring 2018. In these virtually simulated experiences, students embody a patient and are able to gain knowledge, confidence, and empathy, along with better understanding of the impact to patients with chronic diseases or conditions such as macular degeneration and hearing loss, Alzheimer's and Parkinson's disease, and end of life, richly embedded with cultural perspectives. Fast forward to 2020, in which face-to-face teaching and learning is now limited. Embodied Labs came up with a safe solution to continue that virtual learning for nursing students by facilitating virtual reality scenario simulations using a group distributed mode via Zoom. Following the INACSL Standards for Best Practices in Simulated Framework, students are guided through preparation, embodiment, and reflection. A tech wears the VR headset, and faculty facilitate groups of students through the immersive experience.
So I will try to minimize some of the movement. I will look around, but I'll try not to make it too much so you don't feel dizzy. I will be using my hands in certain situations, so you'll see Eden's hands coming forward. And I will try to look around, but also focus when individuals are talking to me. Can everybody see my hands?
Yeah.
Usually a person's external anatomy or gender identity and the brain match. This is referred to as cis male or cis female. When a person's sex and identity don't match, they are transgender. Their external anatomy is one sex, while their brain anatomy reflects a different gender.
So like in the case of Eden, she's a trans woman, but she still was attracted to females, but like it's just not as black and white as you think. So it's really, you just have to ask the person what their identity is for them.
So nice to meet you, Eden. That ring is gorgeous. You look very nice, especially for your first time out. You have good taste in clothes.
I like your makeup too. Next time you might try using a little lighter base. You have such nice facial structure. You don't need much blush.
Next time, bring your wife. She'll find out we're all just people.
Like, I'm looking forward to working with somebody that is trans. I've never had that experience, but I feel like going through this and like I have the tools in my pocket now to be able to provide the best care and to, go above and beyond for them, because it's more complicated than I realized. And as a nurse, we just have such a big role to play in helping them, feel more comfortable in their shoes.
His breathing is more irregular now.
He's not moving his jaw. Do we need to turn him again? His face is purple.
Well, since we turned him recently, we need to let the secretions from the lungs come out. There's a lot of rattle further down there.
Oh, his fingers are really purple.
Again, connecting what we're learning about end of life symptoms, and what are some of the signs and symptoms that you're seeing that correlate to that very near end of days or end of hours?
The gurgling while he was breathing, that's a very common symptom of someone who's getting ready to pass.
Was that an example of Cheyenne Stokes respirations, how it was really rapid and then you would stop for a second and really rapid again?
Yeah, very irregular, and then you see those long pauses.
The group distributed mode allows for experiential learning at a distance, combining technology, science, and Socratic inquiry. Dr. Hannons and Dr. Nevins piloted this new approach during the 2020 spring semester transition to online learning with sophomore and senior students, whose feedback was overwhelmingly positive from the experience. We are exploring opportunities for the wider CSU nursing programs to participate in immersive patient virtual simulations. We would love to hear about your experiences or interests in virtual simulation. If you would like to learn more or further discuss virtual learning, please feel free to reach out to Dr. Jamie Hannons and Dr. Colleen Evans.